Good afternoon. My name is Robert Lustig. I'm a pediatric endocrinologist at the University of California, San Francisco, and we are convening a panel here at the Sugar, Stress, Environment, and Weight Symposium sponsored here at UCLA on food insecurity. My colleagues will introduce each of themselves, and we are going to talk about the elephant in the room, the role of industry in food insecurity, what's gone on, and what we're going to do about it. So please, Cristin.
My name is Cristin Kearns. I'm an assistant professor at the University of California, San Francisco, and I have been studying the organizational behavior of food industry trade groups, particularly the Sugar Association, which represents the cane and beet sugar industry.
Hi, I'm Breanna Hawkins. I'm a policy director with the LA Food Policy Council. We're a collective impact initiative working to promote nutrition, address food insecurity, and promote sustainable food production in the Los Angeles region.
And I'm Kelly Brownell, the Dean of the Sanford School of Public Policy at Duke University, and I'm also the director of a newly created World Food Policy Center there.
So we have an eminently competent and qualified team to discuss the role of industry. The problem, of course, is that there's nobody from industry here. So we'll get to call the shots for a change. Kelly, in all of your work up till now, you have spent a tremendous amount of time calling out big food as being part of the problem. Have you seen any response on their part in terms of accepting any culpability and ultimately making any changes in terms of products, in terms of reformulation, in terms of altering marketing to children, anything at all that we can hang our hat on as to the fact that they're on board?
Well, one issue, first off, is who are we talking about when we say the words food industry? Because, of course, there are a vast number of players there. There are little mom-and-pop markets on the corner, and there are massive agribusiness companies that span the world. But in this context, who we're generally talking about are the big food processing companies. The Coca-Colas, the PepsiCos, Kraft's, Nestle, those kind of companies, and then the trade associations that help represent them. And not surprisingly, they've been contrary to a lot of public health advances that might help improve the public's health. Things like improved nutrition standards in schools, which they were quite opposed to in the beginning. They certainly don't want to change their marketing practices directed at children. There are some things that they're violently opposed to, like soda taxes and things like that. So my own belief is that the industry will play ball only when they feel the bludgeon is about an inch from their head. So somebody needs to come up behind them. There needs to be this bludgeon. That can be bad publicity. It can be the threat of lawsuits. It can take many forms. But once they feel like there's a real threat, then they'll begin to take things seriously. And my sense is that they'll move ahead just enough to get out of the way of that particular bludgeon, and you can work with them in that space at that time. But then another bludgeon needs to get nearby in order to put pressure on them to move forward even more quickly. And I think that's been played out now in a number of venues. So is the industry moving ahead? Yes, under some circumstances. For example, they've been called out for funding scientists, and Coca-Cola in particular got called out for doing that. So they've had to retrench. They've had to stop that funding of those scientists in particular, and they've really reformulated the way they've started approaching this issue. So on that topic, they're doing really well, but they're still fighting like crazy against soda taxes through their trade association. So it's a lot of players doing a lot of different things at different times, but my own sense is that bludgeon metaphor applies here.
Agreed, and I see it as well. Breanna, you work for the LA Food Policy Council. How have you seen changes in food procurement and food supply to the poor population of Los Angeles change as a result of what's going on within public health?
It's a great question. LA sits at the heart of the largest food producing region in the country, yet it has the highest population of food insecure people in the country as well. That paradox is something that we at the LA Food Policy Council take really seriously, and as a result, we've been trying to uplift policy that advances good food that is not only healthy but sustainably produced and accessible to everyone and produced through fair labor. And so we've been able to uphold these standards through a good food procurement policy that we established in the city of Los Angeles, and that was also adopted in the LA Unified School District. And it's like voting with your fork, but with 6,000 forks per day, because that's how many meals the LA Unified School District procures per day. And we've been able to change how the food industry operates, because it has to fit within these value categories around nutrition that were informed by AHA guidelines, as well as sustainability, as well as fair labor. And we've also created additional incentives for the food procurement strategies and policies of the various institutions that adopt this policy to support local, smaller scale food producers that are oftentimes more oriented towards the values of nutrition and better food quality.
Do you see that having any beneficial effect in terms of food insecurity, or does the problem just continue to grow?
Well, a large portion of the food insecure children in Los Angeles are a part of the Los Angeles Unified School District. So the fact that the meals served there are of better quality and also support the local economy, I think, is a win-win for both food insecurity and for supporting restructuring the food industry to be less inclined to support big multinational food corporations. There's still a great need for more comprehensive solutions that I think also address the awareness issue, and also how to increase the knowledge of the fact that both food insecurity and obesity are two parts of the same problem.
Well, as a pediatric endocrinologist taking care of obese children, I can tell you that when I see a kid who's on the National School Breakfast Program, usually that breakfast consists of a bowl of Fruit Loops and a glass of orange juice. And the question is that better than the alternative? In other words, are calories more important than the quality and the nutrition of the food that's actually coming in?
And we say that they don't have to be mutually exclusive, that you can have high quality food that is also nutritious and that's accessible. And that's what the good food purchasing policy does. It supports both nutritious food as well as food that can be accessible to the students there.
Well, Cristin, you've done a yeoman's job of ferreting out the specifics of the food industry tactics over the past 40 years. Have you seen any change in terms of what's going on? You've likened the food industry to the tobacco industry in terms of general strategies. With all that pressure that public health is currently putting on the food industry, do you see any movement?
I think Kelly did a nice job of characterizing the strategies and the responses to things that bubble up in the media. And that's how they approach things. They will usually only act if they're forced to. But I've really come to realize I'm not actually studying the food industry as much as I'm studying the public relations industry. These trade groups hire public relations practitioners and consultants to develop their strategies and tactics. Same to what the tobacco industry did. So it's not necessarily tobacco industry tactics as much as it is public relations tactics. And public relations isn't necessarily good or bad. I mean, the whole point is to create a favorable business environment for a company, which we would expect them to do. But when that favorable business environment harms the public interest, that's where we get into problems. And so I think that that's been the behavior of the sugar industry in particular. And I don't see them changing. So with the added sugars label that we were all hoping was going to get implemented, that's now been delayed,
indefinitely.
That, I'm sure a direct result of sugar industry and other trade groups lobbying. Disclosure of added sugars in products is something the sugar industry has been against for 50 years or maybe 100 years. I mean, a very long time. So they're very skilled at kicking the can down the road, and they will continue to do that for as long as we let them get away with it.
Well, you did say something that sort of resonated in my head, and talked about they market very well. So, what's the difference between marketing and propaganda? So marketing is using information to espouse your point of view. Propaganda is using disinformation to espouse your point of view. The difference is the truth. So when they tell the truth, it's marketing. When they don't, it's propaganda. And the question, I guess, for all of you is how does one deal with the propagandizing of the food industry when basically Congress and the Supreme Court have said that they have free speech?
There's an awful lot of misinformation the companies put out, and you don't have to look any further than the debates around the world and in the U.S. about soda taxes, where for a long time the companies were basically saying there was no relationship between sugar beverage consumption and risk for obesity and diabetes, and very much like the tobacco companies denied it well after the science on the issue was clear. The soda companies have done the same thing, but then they get called out for doing that, and it makes them look bad. So now they've stopped doing that, and they've recognized that excess soda consumption is a problem. So they've just changed the frame, where they say it's not use of the product that's creating a problem, it's overuse of the product, and therefore it's the problem of the consumers if they're consuming more than they ought to. But at the same time, of course, they're pushing consumers to drink as much as they possibly can. So I don't think the industry has much compunction about presenting their point of view in a favorable way. That's, of course, what they do. But when it crosses the line and they're distorting the truth, then that gets to be a real problem. They'll stir up fears. Part of it's propaganda that it's like with soda taxes, that it's Big Brother intervening in your life and calling the shots on your diet, and that ought to be a personal decision that you make. They'll say that the taxes have a regressive effect and would have a negative impact on the community with no data to suggest that at all, and you could make the opposite argument for the benefits of something like a tax. So, they have to sell as much product as they can, and if part of that becomes distorting the truth and doing things in a public relations way that really misleads consumers, I don't see that as anything that they're reluctant to do at all. And you can also look no further than the packaging and the labels on packaging that takes something that's not very healthy but makes it look healthy. So there are just a million examples of this.
Well, the thing is, in drugs, you have to prove efficacy. In food, you actually have to prove harm in order to get anybody to change. So we deal with this all the time. I liken this issue of food insecurity and obesity, which has put the public health community at loggerheads with each other, because here's the obesity contingent saying, we've got to cut back on calories, and here we've got the food insecurity people saying we've got to, provide calories. How do you see this ultimately playing out, and how do we get to direct our, shall we say, our efforts at the appropriate target instead of each other?
I think it's a great question. One of the partners that we work with is the Los Angeles Department of Public Health, and they recently released a report on food insecurity in Los Angeles and talked about the binge and starve phenomenon with folks that are on CalFresh, or the program formerly known as food stamps, SNAP nationally. And it's this paradox that we see where, SNAP participants binge and purchase the lowest cost but highest calorie food options, and then at the end of their benefit period, they don't have any money left, and then they starve. And so it just perpetuates the symptom of obesity and other nutrition-related chronic diseases. And so there is greater awareness of the fact that there needs to be more opportunities for people that are food insecure to be able to access healthier food options. And so one of the things that we've done is embarked on a campaign to get universal EBT access at farmers markets in the city of Los Angeles. We adopted a policy that would require any new farmers market to have to accept EBT, as well as did a ground campaign working with each of the farmers markets to have them voluntarily comply with the policy. We increased from 54% EBT acceptance rate at farmers markets in the city of Los Angeles to 96% over the course of a year, just based on raising the awareness of how bringing federal dollars to support the local food economy can be a win-win for everyone involved, and also raise the visibility of the option to be able to use SNAP to purchase healthy food options. And there are programs out there like Market Match, which double the purchasing power of food insecure people to be able to purchase healthier food options. And we're seeing the medical field play a greater interest in increasing the visibility of programs like this, as well as the food insecurity advocates trying to promote and encourage programs like this that can ensure that not only do food insecure people have access to calories, but to good calories that can sustain them and that can make them less inclined to acquire nutrition-related chronic disease.
Yet the USDA report that came out just a couple of months ago, which they had actually been holding on to for several years because it didn't look very good, said that 40% of the calories purchased on SNAP were in soft drinks. So, I guess the question, and Cristin, please, weigh in here, is how is the Sugar Association and or the Soft Drink Association, basically exerting this effect over the USDA to specifically promulgate this problem, and what measures are they using to thwart our efforts?
Well, I haven't looked directly at exactly what's going on right now, but certainly government health officials are what these trade groups look at as one of their key publics, and so they're setting out to understand who these government officials are in the USDA, and they're people that they keep in regular contact with. And anything that they're doing, the research that they're funding, the statements that they're putting out, the communication documents that they're putting out are all aimed at people within these organizations to try and achieve a policy environment that favors them. So, of course, including high sugary products in SNAP and those types of things are to their benefit. And I would expect that they've been using those same tactics that they've been using for many years, and it will continue to go on and on.
Well, the root of the influence is interesting because sometimes it could be direct influence over something like the USDA by the beverage companies or any other part of the food industry. But it's a little more subtle than that because very often the revolving door applies here, that especially in the current administration when people from industry are invited into important government roles, and then of course they go back to industry after the government changes over. And so there's a lot of hidden interactions around that. But a lot of the influence comes through the elected leaders and the legislators who then put pressure on those regulatory agencies. And the lobbyists are working hard on this kind of thing. And it's
for sure
clear influence.
Legislation always trumps administrative law.
Right, and if
it works.
Just that issue you talked about whether people who are using beneficiaries of the SNAP program should be permitted to buy things like soda. The number I've heard most recently is the government buys $4 billion worth of soda a year, and then people consume it through the SNAP program. Well, the food industry, the beverage industry, sure as heck doesn't want to give up $4 billion in sales. So you can imagine they're going to fight this in any way possible.
Yeah. Well, let's talk about that revolving door. It's been said that the USDA is just, the arm of the food industry, the public arm of the food industry. The FDA is the public arm of the drug industry, and that revolving door continues. We've seen members of the CDC leave or be fired because of their relationships with specific sugared beverage players. We now have a CDC director who has specifically said that Coca-Cola is one of CDC's primary partners and has taken Coca-Cola money in the past. What recourses do public health advocates like ourselves have in terms of sort of holding their feet to the fire to do right?
Well, sunlight plays well. When people for example, the CDC director. My understanding, the press that I read on this was that when she was the health commissioner in Georgia.
She was the state health commissioner.
Right, and in that capacity, it had some kind of a relationship with Coca-Cola, which would make sense because Coca-Cola was headquartered in Atlanta.
They had a childhood obesity directive, and the obesity only got worse.
Well, the obesity's gotten worse in a lot of places. Yes. I'm not sure that there's cause and effect there. But it's not surprising that if you're in Georgia, you're interacting with Coca-Cola. But then when she became head of the CDC, then there was a lot of press attention to whether this relationship with Coca-Cola was going to continue. So I'd be kind of surprised if it happens. going forward. It might, but I'd be a little bit surprised because they don't want that kind of bad publicity.
Well, there were members of the CDC who actually wrote a letter to Tom Frieden before he resigned, basically stating that they were very unhappy with the way the CDC was conducting business, that they were a little too chummy with industry. So I guess the question is, how does one deal with that?
My sense is CDC is going to be less important. The CDC has a lot of good people doing a lot of good things, and I think they're not very subject to industry influence. The USDA, I think, is more so, and that's really where the impact is likely to occur. And there is a ton of interaction with industry. Some of that has to happen, of course, because they're there to make American agriculture work better and thrive. So that interaction is clear. But when it comes in conflict with public health goals, then you've got problems.
Well, you mentioned yourself. Let's talk about this issue of subsidies and what it is we subsidize, because ultimately that is what translates into the cheapest food. So the things we subsidize in this country, corn, wheat, soy, sugar, all of which have been shown to have a problem one way or another in terms of our diet. I guess the question is, what does one do to try to turn that around, especially when organizations like, for instance, the American Legislative Exchange Council is specifically put there to keep it the same?
Yeah, well, in Los Angeles, there's a greater desire to promote urban agriculture and for people to grow their own food because they're tired of being dependent on this industrial food complex that's been making them sick. Or even smaller scale agriculture. And currently the subsidies really support the larger scale monocrop agriculture that's creating a lot of the foods that are cheap but also that are making us sick. So we've been trying to advocate for policy in the upcoming farm bill that supports more beginning small scale rancher and farmer programs that create more diverse food production and that also have sustainable agriculture practices that create more wholesome, healthy food. And it's going to be a struggle because we know that with this current administration, that's probably not going to be a priority and that a lot of the effort is going to be in just sustaining and maintaining the revenue and funding that's already there. So it is a challenge, and we've been looking to other funding mechanisms to be able to support the types of agriculture that we'd like to see that we think can strengthen and transform the food system in Los Angeles.
I agree. I think linking the Farm Bill with our dietary goals at the federal level is really important. And the time period I'm sort of looking at right now related to sugar industry activities in the 1970s was the height of the consumer movement and Ralph Nader and consumer public interest groups. And one effort was to connect those things and really connect agricultural policy with nutrition policy. And the sugar industry was terrified of that happening. And so they worked very hard to keep those two things separate. So the more that we can do to connect those, the better off we'll be.
Well, does it make sense for the USDA to be in charge of agriculture policy and HHS to be in charge of health? In fact, there are 51 separate agencies that regulate the food industry, and most of the regulations actually are working at cross purposes, and they don't necessarily talk to each other. Can any of you talk to the rationale for the USDA being in charge of our health and what we could do to try to streamline, the delivery of health, not health care, but health in America through food?
My sense is that the fact that USDA has nutrition policy under its purview as well as agriculture policy doesn't make sense when the two of those things don't align. Like was said earlier, that if you could align national nutrition priorities with agriculture priorities, then everybody would be a lot better off, including the environment, not just to mention human health. So there are a lot of reasons to do that, but when you have big money involved, as you do with big agriculture, and then the public health, there's really no money involved at all. It's just not a fair fight, and one trumps the other. So I think it would be very helpful if nutrition policy were parked somewhere else in government, maybe with Health and Human Services, maybe with CDC.
Well, I've heard that many times, but I've got a very clear answer to that. and that is that the food industry grosses $1.46 trillion a year in this country, of which $657 billion is gross profit. So that's a gross profit margin of 45%. The next highest industry is big pharma at 18%. So this is their juggernaut. I understand why they don't want to let go. But here's the problem. Healthcare in America costs $3.2 trillion, of which 75% is chronic metabolic disease, of which 75% of that is preventable if we could go back to 1970 rates, and the federal government pays for 65% of all health care delivered in the United States. So when you do the math on that, it turns out that we are spending more on the health care cleaning up the food industry's mess than they are making in profit. That is unsustainable. The problem is everyone's only looking at the positive side of the ledger. How much money can we make? And the U.S. government looks at the tariffs and the money that's brought in through exports. But the fact of the matter is the health care debacle, which falls right in their lap, ultimately costs them way more. So how do we get people to focus on the negative side of the ledger instead of the positive?
Well, and in your calculations, you're not even including the environmental consequences.
Oh, absolutely.
Of the food
Let's add those in.
which would make it even worse.
Sure.
As a society, we're starting to think about taking the externalities of a business transaction. Somebody selling something and somebody buying that thing, and then putting those into the price of the sales. So, for example, with cars, if you have a gas guzzler, you might have to pay more because of gas guzzler taxes. The government policy could just eat that, and it could get passed along to consumers somehow. But it gets embedded in the price, and that affects people's purchasing power. So if the externalities of food production and consumption could be actually borne by the people involved in the financial transaction. That is, we would pay more for meat, for example, because of both the health consequences and the environmental consequences of producing it. Then you could help shift around consumption patterns in ways that would probably better line up with public health priorities. And so there's a little bit of thinking about that with carbon taxes and things like that. So I think we're inching closer to that, but we're not close enough to it now.
Well, I'll throw another monkey wrench into the mix. Why don't we just get rid of food subsidies entirely? Because all they do is distort the market. The Giannini Foundation at UC Berkeley actually modeled what food would look like. Everyone says, well, food prices would go up. Actually, food prices would stay exactly the same, except for two crops, corn and sugar.
Right, but what would you do if subsidies were actually improving public health, which could theoretically be done?
It could be done. I mean, you could subsidize radishes or broccoli, absolutely. You could subsidize the good food and tax the bad. You could subsidize the water and tax the soda and have the tax pay for the subsidy, differential subsidization, yoking them together. The question is, who's listening? How do you get these ideas up to a level where someone actually can do something about it? This really sounds like something that Congress would have to take on. And how do you do that when they're paid off?
I would say I think that health professionals have a major role to play here. And one thing that I am coming to learn is that food industry has really targeted health professionals as a key public and trying to disengage them from the political process. And I think the more that health professionals understand that and know that they can have an influential role in making these changes, maybe we'll get some leverage on our side.
I think there's also a role that local communities can play in also trying to curb behavior through taxes or subsidies. Sugar-sweetened beverage taxes, there was one that was adopted in Berkeley not long ago, and there's some stakeholders in Los Angeles who are also considering one as well. We've seen the positive impacts that it's had in both Berkeley and in Mexico, and I think that having those examples to look to be able to encourage legislators and also skeptics in the community about the potential that this can have, I think is helping us to be able to make it a more viable option.
Yet, Chicago repealed their tax before they even had it enacted.
Exactly.
So, the food industry is alive and well.
Definitely.
And they will continue to be a formidable force for, years to come.
But at the same time, Chicago repealed their tax. Just today, Thailand passed a tax on sugared beverages.
All right.
So I think that, nothing's a straight line. So you've got good progress with things like soda taxes, but there will be setbacks here and there. But I think overall the trajectory is very positive.
Well, let's end the trajectory now. It is 3:30. Our time is up. I hope you have enjoyed this Facebook Live chat with, shall we say, giants of the field, Kelly Brownell, Breanna Hawkins, Cristin Kearns, and myself, Rob Lustig. And with that, I bid you adieu and good eating.